So for this video, we are going to start on our cancer journey and do a content review for the exam material on cancer. For cancers that do have tumors, the first thing you want to do is differentiate between what is a benign tumor and a malignant one. On the picture on the left, it shows a benign tumor. It's well differentiated, it's encapsulated. And this is markedly different than the picture on the left there, where you can see that it's spiculated, there's no rhyme or reason, it's completely disorganized. The picture in the middle depicts the difference between proto-oncogenes and oncogenes. And I'm sure you remember from your homework assignment that that's my dog drinking in the background. The proto-oncogenes are what tells a cell to divide and whether that's still functioning, or if they're the oncogenes where they're just dividing at a rapid rate, which ultimately results in tumor formation. The last picture really looks on a cell level what the difference is between normal cells and cancer cells look like. And I think that picture really shows how different those cells are and why they cause the problems that they do. There are many different components to diagnosing and treating cancer, but it all starts off with the biopsy. The biopsy is where you get a piece of tissue and it shows you how differentiated those cells are. At times you can see if there's lymph node involvement, especially if you're getting lymph node biopsies. And here shows a bunch of pictures as to the many different ways biopsies can be performed. There's shave biopsies, there's bronchs, there's punch biopsies, all depicted. So here's another list that describes all the things that really characterize malignancies. They can't control their cell division, their DNA is not right, they don't have that anchorage so they can go anywhere within the body, they're disorganized, they form tumors, they metastasize, and then they grow cells within these tumors called angiogenesis. They're not differentiated, and they don't function well. So as said before, one of the main differences of benign and malignant tumors are the ability to metastasize. Obviously, that's a hallmark of malignancy. Now, typically, they metastasize through the lymph and the blood system, but they can also spread locally to the adjacent structures around them. So once you have your biopsies, you can start the staging process. And here shows a picture of the different stages that there can be within a tumor. So you can see that there is carcinoma in situ, which means it hasn't broken through the basement membrane. Ideally, if you're going to be diagnosed, this is where you want to be. And then as that progresses, you can see that tumor extending into the basement membrane, into the muscularis propria. And then at times this can get into other organs and structures. The next part of staging is to see if lymph nodes are involved. And that's when you can see if it's 1 to 3, you're an N1. If it's an N2, that's 4 more. And if there isn't any, that obviously is a 0. And then the last part is if there's metastasis or not. So now that we're done talking about staging, we'll look at grading. When you grade a cancer, you're really looking at the cells, and this is another component of that biopsy that's so important, and seeing how differentiated they are. You can see if they're well differentiated. You can still tell what type of tissue they are, but as you get into grade 4, when they're poorly differentiated, they're very dysfunctional. They don't even look like the organ they come from anymore, and this is when you run into a lot of troubles because they're basically useless cells. People with cancer present in many different ways. A lot of times patients will have abdominal pain or swelling. They'll actually have a lump that you can feel. Think about self-breast exams. They can have seizures, unexplained weight loss and cachexia, and that's attributed to the cytokines IL-1, 6, and TNF factors. They also can be short of breath. They can have bleeding, bruising, any number of symptoms. The important thing is to listen to your patient.